Most of us know that the pink ribbon stands for breast cancer, but did you know that the teal one stands for polycystic kidney disease? Earlier this year, my best friend was diagnosed with a disease called polycystic kidney disease. Polycystic kidney disease, also known as PKD, is the fourth leading cause for kidney failure and is one of the most common life-threatening inherited diseases that affect an estimated 500,000 people in the United States. The three main points I will be speaking on is 1, the background information on PKD, the effects that it can have on your body, and the treatments that are available if you have PKD. The definition of PKD would be a disorder that affects the kidneys and other organs. It affects children and adults. Clusters of fluid-filled sacs called cysts develop in the kidneys and interfere with their ability to filter waste products from the blood. The growth of the cyst causes the kidneys to become enlarged and can lead to kidney failure. There are 2 different types of inherited PKD, autosomal recessive PKD and autosomal dominant PKD. Autosomal dominant is passed down from the parent to the child. It is the most common form of PKD, affecting about 1 in every 500 people. It does not skip a generation, and there is usually a family history of it. Parents with autosomal dominant PKD have a 50% chance of passing it down to their child. Autosomal recessive PKD is more rare than autosomal dominant PKD. It affects about 1 in every 20,000 people. And in order to receive the gene that causes this disease, both parents must carry the recessive gene. Some symptoms of PKD are not even seen until someone is in their late 30s or 40s. Symptoms can include back or side pain, a headache, blood in your urine, frequent urination, kidney stones, kidney failure, urinary tract or kidney infections. Half of the people diagnosed with PKD develop kidney failure and will need a transplant by the age of 60. 70% of people will need a kidney transplant by the age of 70. People who have increased risk for kidney failure and also have PKD are men, patients with high blood pressure, patients with protein and blood in their urine, or women with high blood pressure who have had more than 3 pregnancies. PKD affects other organs besides the kidneys. With age, cysts may develop in other organs, particularly the liver. Men and women both experience this, but women's cysts tend to be larger due to their hormones. Some people who suffer from PKD often experience the loss of kidney function. 1 in 4 adults with polycystic kidney disease will develop a mitral valve prolapse, which is a valve in the heart that no longer closes properly. A common complication of polycystic kidney disease is high blood pressure. If untreated, the high blood pressure can increase your chances of getting heart disease and stroke. Pain in your back and side is a common symptom for people who have PKD. The pain can also be associated with a urinary tract infection, a kidney stone, or malignancy. Some people with PKD have been known to develop cataracts or even go blind. People with polycystic kidney disease are more likely to develop a brain aneurysm. An aneurysm is a bulge in blood vessels that can burst suddenly or hemorrhage, which can be fatal. Women who have PKD also want to have children have an 80% chance of having a successful normal pregnancy. Women who have both PKD and high blood pressure are more likely to develop preeclampsia during pregnancy, which is life-threatening for both the baby and the mom. If diagnosed with PKD, sometimes, depending on the person, you may need to develop a lifestyle change. Doctors do not recommend smoking if you have PKD because it can expand the loss of kidney failure. Exercise is recommended to people with PKD, although it is very important to stay hydrated while exercising. Reducing salt intake helps control blood pressure in PKD patients who have high blood pressure. A low diet in fat and moderate in calories is recommended to maintain a healthy weight. The treatments that are out there for PKD are not a cure, but they can help slow down the loss of kidney function. Different treatments would be to carefully control your blood pressure, a prompt treatment with antibiotics of a bladder or a kidney infection, lots of fluids when blood is in the urine, medication to control pain, and people who develop kidney failure will have to go on dialysis or have a transplant. Although a lot of research is being done, there is currently no cure for PKD. Doctors are holding medical trials for the disease, and fundraisers are being done throughout the country to raise money for a cure. I hope you learned a little bit about polycystic kidney disease. I chose this topic to better my understanding of what my friend is going through and to help raise awareness of polycystic kidney disease. You can help me and others raise awareness by participating in a Walk for PKD 2014, being held on October 25th of 2014 at Jim and Joanne Fontero Family Park in Houston, Texas. Or you can donate money on the website walkforpkd.org. For more information, you can also visit that same website, walkforpkd.org, to find out more. Every little bit counts. Thank you.